In our youth-obsessed culture, Hollywood stars will go to extreme measures in order to look younger. But what anti-aging secrets are available to your average Joe and Josephina? To find out, I sat down with board-certified plastic surgeon Elie Levine. Okay, let's talk about it as a general thing. A lot of women are getting all sorts of surgery these days. It seems to have increased tenfold, right?
Absolutely. It's a combination between minimally invasive things and things that are big recoveries and big operations.
Right, okay. So let's start with the upper arm because there's this new thing that everybody wants Michelle Obama's upper arms. Can't we just cover them with sleeves like this?
Well, you can, but
Yeah.
as we head towards the summer where people want to wear tank tops and clothing like that, it's understandable why people would want to expose those areas of their body. That procedure, that area of the body
Yeah.
has undergone revolutionary changes because the traditional way of lifting arms works dramatically. You can get a significant amount of improvement in shape, but there's significant scars with it.
Right.
Nowadays,
I would think you would cut and then there's a whole scar there.
correct, and
no
that's
more?
a more traditional way. And for people with a lot of excess skin, that works great for them. But for people who just have a minimal amount of laxity,
Like
no
that
matter
picture?
well, that's significant amount of
That was
laxity.
significant, yeah.
Doing laser underneath the skin can help tighten that skin dramatically.
Oh, really?
With minimal 1-2 millimeter scars.
That must hurt, though. That's got to hurt.
Well, not really. You can do those kind of procedures under local with patients awake. Pain on a scale of 1 to 10, I'd probably put it at 2 or 3. But for people that say I don't want to feel anything, give them a little bit of twilight anesthesia and they're good to go.
I mean, I realize you're not the person to ask this, but why do women hate their arms and their behinds and their thighs and everything else? Why can't we just love everything?
I think it's a combination of things. I think it's probably internal, but it's also societal. I think we put that upon women often.
We do, in the magazines. But you, as a doctor of plastic surgery, you're complicit in that, aren't you?
You know, I never say to a patient, you need this. It's always asking them what bothers them. And ultimately, that's really the important thing.
I know. What bothers women is what the magazines tell us to bother ourselves about. You
Maybe.
know?
Or their mothers.
Or their mothers, or their husbands. I don't even think it's about their husbands.
I don't think it's their
husbands. I think
husbands.
it's other women that make women do these things, don't you?
You said that, not me.
Yeah, I think it's true. I mean, they found that the most wanted arms belong to Jennifer Aniston is another one. They all want her arms.
Well, it's not just her arms. I mean, she's been all over the newspapers and tabloids for years.
Right. Do you think she's had a lot of surgery?
Oh, I don't know.
Come on, you know. You know. Then there's the issue of the mommy makeover. I mean, women have babies and they're supposed to snap back like that to get their flat tummies back, and boobies are supposed to be alert again. I mean,
it's amazing. I find it amazing how surprised women are after having kids that this is what having kids does to their body. I think it's kind of maybe their parents, grandparents who want to have grandchildren who don't tell them, but it does take its toll. Anything from your chest to your belly to little things like varicose veins and little spiders, spider veins, and discoloration on the face, and all related to pregnancy.
I never got that, but I do trip over my breasts. Is that normal on a treadmill, sir? Now, I have a girlfriend who, after she breastfed, the boobs were just like flattened out and sort of droopity. And so she had implants.
A friend?
A friend. She had implants put in there.
Yes.
But now she's like 65 years old. And doesn't it look kind of weird when you're old and everything else is sort of old and these attentive boobs?
Well, what does she think about them?
She's okay with it.
No, there are all kinds of procedures and there are variations with that. Sometimes people don't even put in an implant. They just need a breast lift to bring their shape back the way it was.
Don't you have scars for that?
Scars fade really nicely, and they're hidden where even if someone's wearing low-cut clothing, they hide.
Yeah. Breast reduction I can understand because you don't want to walk around like the Hunchback of Notre Dame. What about liposuction? I'm frightened of anything. And all of these things scare me, but I'm not against Botox and Restylane. That I love.
That you like, okay.
Yeah, that's okay.
Good.
And needles are okay, but cutting is a whole other deal.
So liposuction is minimal cutting, 2-3 millimeter incisions, tiny little things. The thing that's really changed with liposuction the last number of years is the ability to tighten skin. So it's not just about fat removal. That's in so many ways the easy part of it, and there's so many different ways to do it, whether it's laser, whether it's traditional, or whether it's freezing it. Removing fat's pretty straightforward. Tightening skin, that's where it gets more interesting, and that's where you see the dramatic results.
So liposuction has gotten so much better in the past, 10 years than it used to be?
Yes. Definitely. It's the type of thing where people can do it awake. They don't even necessarily need to go to sleep. Downtime is virtually non-existent. and the scars
Really?
are hidden. You feel sore after liposuction, typically not real pain.
So, I mean, the belly hanging over is not attractive. I mean, I can see sucking that out, can't you? Yeah. But the men, do men go in for, like, they want to get that six-pack?
So men, there are significantly more men doing plastic surgery. And it's liposuction, it's eyes, it's noses, it's lasers, Botox, little things too.
Yeah.
I think we're just a little more in tune, or the world is a little more in tune to men, and not just how they look, but fashion, hair, everything.
Yeah. Do you think it's because we're living longer that all of this is going on? Because, at 40, you could start to sag. And you're just 40. You've got another at least 40, 50 years to go these days. When you're 40.
Maybe. I also think the technology allows us to do more and do it in a way with showing less scars.
Yeah.
So that just makes people more interested.
Okay, when we come back, I want to ask you about man boobs. We'll be right back. I'm back with Dr. Elie Levine, who is a plastic surgeon extraordinaire. I will say that for you. Now, men are getting a lot of cosmetic surgery, as you said before. What about man boobs? First of all, men can get breast cancer, I understand.
They can. The numbers are significantly lower. And
Right.
whenever you remove anything, male or female, from the breast, you always send it off and have it analyzed. But it's unusual to see that.
Is that because men don't have estrogen?
Probably. That's probably a big factor. I mean, we have estrogen, but in terms of the same numbers, we don't have them.
Yeah.
Men are very self-conscious about their chests.
Yeah.
They won't take their shirt off at the beach. They just
can't blame them.
No, and a lot of it's genetic. It's not just, some of it's weight related, but some of it, no matter how often they work out and no matter what they do, they still have them.
Yeah.
And coming in is...
Now, how hard is that procedure? Because I feel for a man with that.
So the majority of patients can be treated with liposuction and skin tightening, or laser liposuction, without needing any real incisions.
So you just can suck the fat out of those
and tighten the skin down.
Really? And that doesn't hurt or have a lot of downtime?
It has about a week's worth of downtime, but it doesn't hurt very much, and the recovery is pretty easy. There are a small number of patients that need skin removed as well, but that's a minority. The vast majority of people really just need some form of a liposuction procedure.
What do you think is going to happen to Chris Christie when he loses all this weight? Because he's pretty fat.
He's going to need to visit a plastic surgeon.
He will, right?
Absolutely.
Yeah.
Because he's going to have a significant amount of skin redundancy and excess, and it's going to be everywhere. I mean, you see it on his neck already.
Yeah.
The belly, the arms,
he's
you
rotund.
name it.
He was. He is. He's like 350, 400 pounds.
Yes.
Really fat. And he knows it now. And I'm happy that he's doing this, although it kills my whole act. All right, let's talk about these less invasive things. You have a facial resurfacing laser peel. Tell me about that.
Right. So laser resurfacing is typically using an erbium laser where you peel off the outer layer of skin, and in addition, you do a fractionated laser to help build collagen from underneath.
Oh.
And it takes years off of the skin. And it's a great procedure by itself, and it's a great procedure in combination with a facelift. Because even if someone does a facelift, they may get rid of the excess skin of the neck and the jowls and everything like that. But if their skin texture and they have a lot of wrinkling, it gives away their age. So tightening down the skin and getting rid of that regularity
Now, that's
works
not
great.
the same as a Fraxel.
Fraxel.
It is
Yes.
Fraxel.
Yes.
Well, I had that.
You look great.
I had that. They did this thing like they vacuumed my face. They
Right.
took off all these brown spots from the sun. I had a few. And I think my skin looks 10 times better, but it didn't tighten anything particularly.
Oh, well, a lot of times
Maybe
it
it
does.
did. I don't even know. Do I look younger than springtime? Yes. So there's the laser Fraxel, you call it.
Correct.
Fraxel. Okay. And what else should you do for your face like that?
So the other thing that a lot of times that people do is if they have a lot of sunspots. So it's a sign
Like
of
this.
aging. And that makes you look older. So someone, everything else aside, if they have a lot of photo damage, doing a laser treatment, an IPL or a BBL, which has no downtime whatsoever, removes and eliminates those spots.
That's
And
just a zap.
it's quick.
Yeah,
it's
that's a
10
zap.
minutes in the office.
Right.
Your skin doesn't look all that different right away, and then about a week or two later, those sunspots start falling off, and your skin shines so
With
much
the
more.
Fraxel, there is a little downtime. Although I did
That
go
is
to
a
a
little
party
bit.
the next day, and no one even noticed it. No one's even looking at anybody anymore. You know, I went in and I had my hair over my face, wore a mustache. No. Okay. Now, what's a mini laser peel? And how much did that Fraxel cost? I don't remember how much it was.
A Fraxel depends on what you're doing and how extensive it is. Anywhere from like $500 to $1,500.
I see. And the laser zapping the spots?
About anywhere from $300 to $500.
Okay. That's worth it, though, because
It
those
is.
could be precancerous.
Could be.
Yeah.
Hopefully not.
Earlobe lift. What about
Earlobe
that?
lift. So there's no real structure or integrity in your earlobes. So if you're wearing hanging...
They're liars, aren't they? There's no integrity whatsoever.
No integrity whatsoever.
Yeah.
If you're wearing earrings that are heavy for an extended period of time, for years, and they pull down in your earlobe can get stretched out.
Yeah.
And you can actually reduce your earlobe, and it looks so much younger. And it's one of the biggest areas of growth in my practice. People are coming in all the time. Combination, some people that have bothered them for years, and other people that have had facelift done elsewhere, and they notice this more now afterwards, and it's something that
You know,
works
sometimes the
nicely.
celebrities will sit next to me on The View, and I can see what's going on really easily.
Right.
And there's this line under here a lot. Is that just a sucking out, or is that a facelift?
That could be just sucking out. It could even be a chin implant, but typically it's a face and neck lift.
It's a whole lift, isn't
Typically,
it? Yeah.
yes.
Thanks to Dr. Elie Levine and all my guests tonight. See you next time.